A seismic shift in America's childhood vaccination landscape is about to unfold, and what happens in the next 48 hours could redefine how we protect our youngest citizens from preventable diseases. On Thursday and Friday, a completely reconstituted CDC advisory panel, hand-picked by Health Secretary Robert F. Kennedy Jr., will cast votes that could dramatically alter the immunization protocols that have safeguarded American children for decades. The stakes couldn't be higher, and the medical establishment is watching with growing alarm. Here's where it gets controversial. Kennedy, who has spent years challenging vaccine orthodoxy, didn't just reshape policy. He completely dismantled the existing system. After assuming his role as the nation's top health official under President Trump's administration, Kennedy made the unprecedented decision to terminate all 17 members of the Centers for Disease Control and Prevention's Advisory Committee on Immunization Practices. In their place, he installed a streamlined 12-member panel, many of whom have publicly questioned conventional vaccine recommendations. The committee gathering in Atlanta represents one of the most consequential policy pivot points in recent public health history. Medical professionals across the country warn that the proposed changes could leave countless Americans vulnerable to diseases that previous generations had successfully controlled. But here's the part most people miss. The new committee chairman, Martin Kulldorff, opened the two-day Atlanta conference not with medical data, but with a fierce defense of his panel's scientific integrity while simultaneously launching pointed criticism at agency leadership. Kulldorff, a biostatistician and epidemiologist who gained prominence for his vocal opposition to COVID-19 lockdown measures, found himself dismissed from Harvard after refusing coronavirus vaccination. Now, he's at the center of America's vaccine policy transformation. "We are not anti-vaccine, but pro-vaccine," Kulldorff declared, though his definition of pro-vaccine might surprise many. The panel has already made waves by discontinuing distribution of influenza vaccines containing thimerosal, a mercury-based preservative that has been extensively studied for decades without evidence of safety concerns. Kulldorff labeled thimerosal a known toxin, despite scientific consensus supporting its safety profile. And this is where the story takes an even more dramatic turn. The previous CDC director, Susan Menares, was abruptly terminated last month following heated disagreements with Kennedy regarding vaccine policy directions. Menares later testified that Kennedy had pressured her to automatically approve recommendations without proper scientific review. Allegations that paint a troubling picture of political interference in medical decision-making. The specific votes scheduled for this week target two critical childhood immunizations. Thursday's agenda includes a decision on the combined measles, mumps, rubella, varicella, MMRV vaccine for children under 4 years old. The committee is considering removing the recommendation based on studies indicating slightly elevated seizure risks compared to administering separate MMR and varicella shots. However, critics argue that the current CDC guidance already addresses this concern by recommending separate vaccines for this age group unless parents specifically request the combination. Friday's vote carries even more significant implications. Whether newborn babies should continue receiving hepatitis B vaccination immediately at birth, or if this protection should be delayed until 1 month of age, or left to individual clinical decisions between doctors and mothers. This recommendation change could prove particularly controversial given the overwhelming success of the birth dose strategy. The numbers tell a compelling story that vaccine advocates are eager to highlight. When universal newborn hepatitis B vaccination began in 1991, the United States witnessed a remarkable 80% reduction in annual deaths from the disease by 2000. The hepatitis B virus can cause devastating liver damage, including cancer and cirrhosis, often proving fatal if left unchecked. Noel Brewer, one of the dismissed committee members, emphasized the critical importance of the birth dose timing. The U.S. struggled to make meaningful progress against hepatitis B until implementing the birth dose strategy. Previous attempts at risk-based vaccination approaches proved largely ineffective because high-risk individuals rarely recognize themselves as such. What makes this situation even more contentious is the broader context of Kennedy's appointment and his well-documented history of vaccine skepticism. His transformation from environmental lawyer to the nation's top health official represents one of the most dramatic ideological shifts in federal health policy leadership in recent memory. The committee will also address universal hepatitis B testing for pregnant women, a measure that many physicians consider essential for identifying mothers who could transmit the virus to their newborns during delivery. This testing protocol serves as a crucial safety net in the current vaccination strategy. Several senior CDC officials have resigned in protest, citing deep concerns that critical policy decisions affecting millions of children are being made without adequate scientific review or consideration of established evidence. Their departures signal unprecedented turmoil within the nation's premier public health institution. Kulldorff responded to criticism by challenging 9 former CDC directors to public debates, dismissing their characterizations of his committee as unqualified or holding dangerous views. His confrontational approach reflects the broader tensions surrounding Kennedy's leadership style and policy priorities. The timing of these votes is particularly significant. Monterez's Senate testimony revealed that Kennedy had informed her in August that vaccine schedule changes would occur in September, suggesting that these committee votes may be fulfilling a predetermined agenda rather than responding to new scientific evidence or emerging public health needs. Traditionally, CDC directors have maintained the authority to approve or reject advisory committee recommendations, providing a final layer of scientific oversight. However, with Monterez's dismissal and the installation of Kennedy's chosen leadership, this traditional check-and-balance system has been fundamentally altered. The medical community's response has been swift and largely critical. Established physicians and public health experts argue that decades of carefully constructed immunization schedules based on extensive research and real-world outcomes are being dismantled based on ideological rather than scientific considerations. Supporters of the changes argue that the current system has become too rigid and fails to account for legitimate concerns about vaccine safety and individual choice. They contend that a more flexible, personalized approach to childhood immunization could better serve families while maintaining public health protections. The controversy extends beyond specific vaccine recommendations to fundamental questions about how public health policy should be developed and implemented. Should established scientific consensus drive policy decisions, or is there room for alternative interpretations of existing data? What's happening in Atlanta this week represents more than policy adjustments. It's a complete reimagining of how America approaches childhood disease prevention. The outcomes of these votes will likely influence immunization practices for years to come, potentially affecting millions of children and families. The broader implications reach into questions of trust in public health institutions, the role of political appointees in scientific decision-making, and the balance between individual choice and collective protection. These debates reflect deeper societal divisions about expertise, authority, and the proper relationship between government recommendations and personal freedom. As the votes approach, one thing remains certain. Whatever happens in Atlanta will not end the conversation about childhood vaccines in America. Instead, it may well intensify debates that have simmered for decades, bringing them to the forefront of national political and health policy discussions. The question facing every parent, healthcare provider, and policymaker is whether these changes represent necessary course corrections based on evolving scientific understanding or dangerous departures from proven public health strategies that have protected generations of American children. What do you think? Are we witnessing a long overdue reassessment of childhood vaccination policies that puts individual choice and updated science first? Or are we watching the systematic dismantling of one of public health's greatest achievements? Should political appointees have this level of influence over medical recommendations that affect millions of children? Or should these decisions remain insulated from political considerations? The debate is far from over, and your voice matters in shaping how we move forward.